Hi everyone, I'm Dr. Jomaa, the sports med specialist, and welcome back to my Brazilian Jiu-Jitsu injury series. So today we're tackling an important topic, neck injuries in grappling sports. In today's video, I'm going to walk you through the most common neck injuries in grappling sports, how they happen, what symptoms to look out for, and importantly, how to stay on the mats longer and safer. Stick around to the end for my top prevention tips and a demonstration of one key exercise that will help prevent injury and improve strength and stability of your neck. If you know anyone who might benefit from this video, please forward it on to help the channel grow and to get more of this sort of content out to you. Before we dive in, please remember that this is all just educational and informational content. It's not medical advice, and if you do have an injury, make sure to see your own healthcare professional. So let's outline the most common neck injuries. Neck injuries in grappling sports range from mild muscle strains to serious conditions that could sideline you for months. So number one is muscle, tendon, and ligament sprains. These are usually grouped together under the subheading of mechanical neck pain. They're the most common and usually the quickest to recover with proper rehabilitation. After that, we'll talk about cervical disc injuries. These are a bit more serious and they can certainly involve some nerve compression, which we'll touch on. Number three, speaking of nerve compression, we'll talk about stingers and brachial plexus injuries. Number four, we'll talk about the facet joint and injuries to this area. This is quite common and it causes a pinching and localized pain on the side of your neck. And number five, we'll talk about more serious injuries like fractures, dislocations, and whilst these are quite rare, they can be life-altering. So we'll talk about how they need to be handled in the immediate setting. So let's kick off with mechanical neck pain. As I said, muscles and tendon strains, they're very common in grappling sports. They typically occur due to a relative overload of these soft tissue structures compared to their usual baseline loading capacity. So this could be a sudden explosive movement like bridging or looking to escape a mount or resisting a submission. But most commonly, there's actually more of a cumulative overload that brings on this pain. A common story might be that someone picked up an extra training session in the week, or they've decided to go a couple of days in a row, taking on 2 classes in one day, and it leaves their neck feeling stiff and sore. Regarding ligament sprains, these are usually more due to if the neck is forced beyond its normal range of motion, such as a neck crank or stacking, but the principles remain the same. So the key symptoms for these mechanical issues include pain, stiffness, and some mild swelling. Usually it's that pain and stiffness and tightness associated with looking in one particular direction. The good news is that these injuries will usually heal with proper rest and recovery. In the short term, maybe the first 48 hours, ice can reduce swelling. Following that, we recommend gentle range of motion exercises and progressive stretching. Avoid rushing back to training as the pain and stiffness are usually a sign that these supportive structures are still quite weak. And so when they are, the neck is less protected, which increases the risk of worsening or complicating the injury, which can end up leading to chronic pain issues. So number two, cervical disc and nerve injuries. Now the discs themselves are made of a thick fibrous band which contains within it a jelly-like substance. Repeated pressure, awkward positioning of the neck, especially when it's quite weak, in hyperflexed positions like maybe getting stacked in a guard pass, or neck cranks, or just long-term poor posture and weakness of the neck, can lead to wearing down and weakening of this fibrotic band around the discs. And this can lead to an extrusion of the gel-like substance outside of the disc. When we look at this on MRI scans, it often looks like just toothpaste being squirted out of a tube. Now, depending on where in the disc this has occurred, this gel-like substance can end up putting pressure on the nerve roots. Pressure on the nerve causes a sharp, burning electrical pain, which we call radiculopathy. This shoots down from the neck into the hand, usually in a pattern consistent with which nerve has been injured or pressured. Nerve injuries affect all functions of the nerve, and so a patient will usually have sensory changes like pins and needles and reduced sensation, motor changes such as weakness in the affected function of the nerve root, and reduced reflexes. These injuries are more serious than a strain and far more painful too. Ask any patient that's had them. But the good news is that the majority of these do settle down with time, even without intervention. But the reality is that that can take up to several months, and in rare cases, these injuries may lead to long-term damage if left untreated. So the bottom line is, if you're experiencing these type of symptoms, it's time to see a physician. Management is usually quite straightforward. Rehabilitation that focuses on reducing inflammation, strengthening the neck and the surrounding muscles, and correcting posture. In some cases, an MRI can help explore the pattern of injury, and it'll often show us exactly which nerve is affected. Often a steroid injection around the nerve root can help settle down pain for a while. And in severe cases, if there's a progressive reduction in nerve function, these might require surgical intervention. So next we'll talk about stingers and brachial plexus injuries. A stinger occurs when the brachial plexus, which is the network of nerves running from your neck to your arm, is stretched or compressed. So what do they feel like? Well, a stinger is a sharp, burning sensation that suddenly comes on, shooting down the arm with sudden onset heaviness and weakness in that arm as well. The symptoms are usually temporary and they resolve within minutes to hours in most cases. That being said, most stingers don't require medical treatment, but if you do experience persistent weakness, recurrent stingers, then it's really worth getting evaluated. If you do have one of these injuries, then you can start strengthening the neck almost straight away, and it actually helps to encourage the return of nerve function. Practicing proper head posture during combat can help reduce the risk of these injuries as well. Okay, so now we're going to talk about facet joint injuries. The facet joints are the small joints in the neck that help guide movement into forward and lateral flexion. These joints are loaded up when we extend the neck or flex it, or if we twist it and extend it at the same time. And as such, a sudden loaded twisting or hyperextension of the neck can lead to a locking up of these joints. So what happens? Well, the joints become quite inflamed, they're painful to load up, and the patient describes a pinpoint localized pain on one side of the neck with associated stiffness. And treatment for these includes time for rest, manual therapy, gentle mobilization exercises, strengthening the neck muscles, as well as a course of anti-inflammatories. Okay, and finally, it's time to mention the serious injuries such as fractures and dislocations. Whilst they're quite rare, they can occur during high impact events like a slam or an awkward fall during a takedown. The presentation is very dramatic: severe pain, visible deformity, difficulty moving, and usually coinciding with the patient reporting a feeling that the head is unstable. Neurological symptoms like the ones described earlier can also occur. In the worst case scenarios, there can also be a risk of paralysis. In these instances, especially if there's a traumatic mechanism associated with a concussion, then the neck should be immobilized immediately. Immediate medical attention should be sought. It's quite critical that there's a safe extraction for these patients. They often require imaging, prolonged periods of immobilization, and in some cases, urgent surgery. Prevention is, of course, the best approach. Always tap early and avoid being dumped down in takedowns as much as possible. Certainly don't do it to other people so that they don't do it to you. What are my top tips for preventing neck injuries in grappling sports? Well, number one, strengthen your neck. Incorporate exercises like isometric holds, range of motion against gravity, neck bridges, and resistance band work into your routine. We'll go over my favorite exercise for neck strengthening at the end of this video. Number two, focus on technique. Avoid bad habits like getting your head and neck caught in the wrong positions or in cranking submissions. Number three, this one's fairly common sense. If you're caught in a submission targeting the neck, then tap early. It's not worth the injury. And number four, take the time that you need to rest and recover. Too many BJJ athletes get back to sport too early, and they're left with weakened, stiffened, soft tissues that can increase their risk of chronic pain and subsequent injury. So in summary, neck injuries are very common and almost inevitable as a part of grappling sports, but in most cases they're manageable with good care and avoidable with good continuous strengthening rehabilitation exercises. So as promised, I'll show you now an easy to perform rehabilitation exercise that's helped my patients increase their neck stability, strength, and reduce their injury risk too. Start by lying on a flat surface with your head off the edge of the bed. The first step is to get your head to be parallel to the ceiling above, so looking straight up above. This is actually quite a difficult position to get into. You might find that you're inclined to extend the neck to rest it, or in many cases, patients will protract their neck forward. From this position, we can do a number of different movements. So the first of which is to bring our chin to our chest. The next is to bring the chin to the shoulder. Nice and controlled movements. And when you're looking to look over your shoulders, you can try and push a further and further range each time. And the final movement is to bring the ear to the shoulder and then back to the midline. Once you've completed all of these movements, you've essentially completed one rep. Now, ideally, you want to start with as many reps as you can tolerate and gradually build up over time. I've definitely seen a very strong correlation between the patients that do these exercises diligently, an improvement in their posture, a reduction in their protraction of their neck, an increase in their time on the mat with reduced risk of injury. Thank you for watching this video. If you've made it this far, then please give it a like and subscribe to my channel for more injury tips and grappling injury specific insights. If you have a question or a topic you'd like to cover, drop it in the comments section below. Stay healthy, keep training, and I'll see you in the next video.